Hello friends, Sarah here from the Centre for Mental Health. I hope all is well this week. It's a bit dark in this room now because the winter is finally here. It does kind of make this space a bit dark, but I hope it's fine for the film. Anyway, this week has been a huge week for children and young people's mental health. We have had a number of reports published giving us lots of information that we have tried our very best to distill for you. And if you head over to our website now, you will be able to read some analysis of all of the information we've had this week and a great blog from Lorraine Khan breaking down the data and really helping make sense of that. But it's my job to give you a bit of a roundup of all the things that we've heard. And I think it's important to start with the news from NHS Digital on Thursday that told us that 1 in 8 child has experience of emotional distress, mental health condition. That's 3 in every classroom, and that is a small but really significant increase since the last time that this information was published. What we also know is that there are some changes in the experiences of boys and girls and ethnicity. And some of that information is really important for the design of interventions and services as we go forward. There are gender differences that we need to pay attention to. And indeed, we're seeing an increase in the numbers of boys from a very young age experiencing mental distress. The interesting thing about this survey is it is the first time that information for children between 2 and 17 has been identified. It's really important information. So we need to really think about how we're going to use it going forward. And we at the Centre often translate this information for our partners so that they can design their services accordingly. And this week we have published a report from the Wish Centre. We evaluated the services, and so indeed we are seeing already services really moulding what they do around the needs of the young person. The Wish Centre, which delivers services all over London, basically demonstrates an 80% success rate. Their intervention works, and it works because it's a mixture of a number of things. Really understanding what is impacting the young person. What are the factors? Is it school? Is it home? Is it their community? Lots of other things. Sexuality, for instance. Indeed, we recommend some further research in that space. But they also deliver psychotherapy and, importantly, peer support. A combination, a recipe that really promises huge things for individuals that can access that service. We're obviously recommending that this service is kind of scaled up, that other local authorities around the country and CCGs really think about commissioning this type of service that flexes and moves with the young person. And that's really kind of what the data is saying from the prevalence survey. In order for us to really make a difference, we have to really find out where the problem starts. And when we're hearing problems are starting in primary school, then we really must develop services that attend to that time in a child's life. We also heard from the Gambling Commission that the numbers of children or young people accessing gambling opportunities has also risen by about 2% since last year. We know that gambling, if it's problematic, certainly degrades the entire family's mental health. And to hear an increase for the age group of between 11 and 16 is hugely worrying. And there are attempts already to think about how to deal with that in terms of advertising and how easy it is to access these opportunities. That's really important. What we also know is that the Children's Commissioner came out and said that she'd seen an improvement in child and adolescent mental health services this week. She said she'd like to see an improvement in eating disorder services, services that are addressing youth violence and perinatal support. We would agree and absolutely commend her findings. But we also need to recognise progress where progress has been made. It is really important to know that all of the work in transforming CAMHS, child and adolescent mental health services, is starting to take effect. But like everything that we say from the centre, we are clear that it's not just one part of the system. The NHS by itself is not the solution. And if we really want to help children, we need to think about everything that they touch, everything that they come into contact with: school, home life, their accommodation, their community. You know, what do they have in terms of resources to develop their health and well-being? We know that all of those things are still very important. There's been some really interesting dialogue over on Twitter. Claire Murdoch from NHS England absolutely supports our plea that other parts of the system need to be stepping up to work with children. Gregor Henderson, another one of our partners from Public Health England, makes the important point that all of the system therefore needs to be funded and resourced to do that. The analogy between a village, it takes a village to raise a child, is one that I absolutely support. But the entire village does need to be resourced. And I think what we're talking about here is recognising that children are complex. Actually, it's not straightforward. We need to think about parenting programmes. We need to think about public health interventions that don't wait until distress is visible. There are things that we can do. This week we've been able to demonstrate the absolute beauty and kind of positive impact that peer support has had on young people's self-harming behaviour. Sometimes we have the answers. It's just about making sure that we share them with the right people. As always, we're keen to hear what you think. And if you have a question about the information that you heard this week from the number of reports that were published, let us know. We'll do our best to answer any of the things that you are concerned about. See you next time, but do head over to the Centre for Mental Health website and of course the Children and Young People's website, the Coalition website, that has a huge amount of information on there. Still a way to go, and I'm keen to hear your thoughts. Speak to you next time.